Hi everyone. So I'll just start with thanking Vineet for inviting me and having me here. Thank you everyone for joining. I'll just start with introducing myself first, telling a little about my journey till now in the industry and all. So I am having around 10 years experience in conversational AI in different startups. This is my second venture together with my partner Devasis, and in previous company also we were into the conversational AI and chatbots, and we sold it to another analytics company called Koros, and we started our journey with Kommunicate in 2020 around, and it's have been 2.5 years journey till now. uh, yeah, so this is about me. And yes, we'll talk about more about conversational AI and impact of it uh, in couple of next slides. Yeah, if we just talk about the market size, overall, I can say that tech adoption in healthcare is very less. For example, if you take examples of any e-commerce website, you go to any other e-commerce website and you will have the AI chatbot there. But this is not the case with hospitals and clinics, right? So if you go there, still a lot of things are manual. But we are seeing really good growth in recent years, and it is expected to touch $1,000 billion industry only for the chatbots by 2030 or so. And we can see the growth is also really good. Around it is touching around 17%. If we segment the overall market, we can see different segment based on the type of the chatbots. And so for example, earlier days, the chatbots were rule based, where you can define if X happened then do Y, right? But now it's based on the machine learning, so you can divide chatbot market based on these, the type of chatbots basically, and then you can divide the overall market by what kind of applications or what kind of users basically using them. So for example, is it used for the appointments, or it is used by any health tech company? So these are the market segments you can divide upon. I'll just talk about few of the benefits of chatbots. Uh, yeah, so if you see the benefits of chatbots, first and foremost benefit is the self-serve. If you go to any site, uh, once you start interacting with the chatbots, it removes the manual intervention and dependencies. As soon as manual interventions and dependencies are removed, you can scale fast and cut down your cost. Like, let's say if you need to onboard and train a new employee in your organization, right? And if you need to deploy a new chatbot, so that's pretty easy to deploy a new chatbot rather than training and then manually onboarding and explaining everything, like from the process to everything, and then the monitoring also comes into the picture. So that way it's a very cost effective, and obviously happy customers. In our case, like let's say if you talk about the healthcare, it's a patient. So obviously the happy patients means, like it all leads to the revenue growth. Yeah, so in this diagram, I was trying to explain a little bit about conversational AI, where it fits into the healthcare ecosystem. So if you check, like If you start with the awareness, for example, let's say someone is coming to your site, right? uh, so chatbot start guiding them what to do next. For example, you know, very simple example is how to do booking, right? Or it can tell you whether the hospital has parking or not. This is very simple thing, but very useful. But let's say if you need to ask this by calling, some hospital, that becomes a tedious task. If you see the overall flywheel, it fits into every stages, from guiding on website, as I explained, to collecting the feedback to enhance, patient experience. It's also provide, the omni-channel support. Omni-channel means, like, whether the user is on Facebook, they can interact from there, right? Or they can interact from even, WhatsApp, right? Or some other means. But all the conversations come to the single chatbot. It can, basically centralize all the medium to a single one. So that's the very big advantage of that. So now in the further slides, I will go through certain, the use cases specifically for the chatbot. So for example, if we take telemedicines, so in telemedicine, I guess, we have seen a huge benefit of telemedicine in COVID period. Apps like Practo or 1mg in India helped a lot during, the COVID period, where the overall health system was very overloaded. There was no appointment we are getting, from the hospitals, regular hospitals, and all. And then these, apps basically helped a lot. And now we see, the adoption is quite high. For example, imagine you are living 200 kilometers from your specialist doctor, right? Is it possible to get the immediate help? No, it is the only options to get the immediate diagnosis and all. So, from online consultation, getting some advice from the doctor, or even if it is a critical, situations, or for to the payment processing, everything is, now available via telemedicines. So one of the example for our customer who is using our mobile SDK to automate everything, and they are actually providing food recommendations on your day-to-day activities and all. So I'll just say, yeah, so you can see they are suggesting, based on your preferences and other activities, they are suggesting what to take at what time and all, and it's all automated. It's our one of the US client, which is, using automated everything using AI chatbot. Yeah. So yeah, this is one of the most used feature of the chatbot we see in the industry right now. Even I am saying it is the most used feature, but still only 26% of healthcare providers are actually using, this option, like option to book appointment seamlessly. The rest is still need, right, to call you and go there manually and do the appointment bookings. So this is one of the most used feature, as well as most prominent feature used in the healthcare industry right now. It is also help in appointment scheduling, as well as gathering, the initial data for screening some symptoms and all. And there are a lot of applications coming into the market for pre-screenings and symptom checkings, that helping a lot when uh, for example, let's say whether you need to go to the doctor or not, they will tell you in advance, do you need to worry about these symptoms or not, how critical these are. Is it common cold and cough, or let's say, no, you need immediate attention. So these are few of the things right now, using chatbot and AI labs are providing, and that's really helpful. We'll see few more use cases, like you know prescriptions and lab test reports, right? So this is one of the future where we see the healthcare industry, especially in terms of AI, it will go where the generative AI through LLM and all help a lot. For example, the platforms like ChatGPT can scan the lab test report and tell you in advance, do some analysis, and then give you, you know, some analysis like whether these reports are fine, or you need to do some, uh, mm, you need to go for the further, test, or let's say contact doctor immediately and all. This also helps doctor to, help in diagnosis, where the chances of errors are less.
I think there's some background noise. You can mute the. Let me try.
The mic is off.
You have to same as select the speaker. Okay. I guess we're getting some.
August checked, I think.
Voice. If you guys can mute yourself, it would be really helpful.
Yep.
You can see here if you are unmuted or not.
You can mute. There you go.
Okay, cool. Just I was explaining about the role of ChatGPT into scanning the lab reports and suggesting how critical these are, whether your parameters are up to the mark, or you need immediate consultation with the doctors and all. Yeah, nowadays everyone is using apps which reminds them, about drinking waters at certain intervals, or let's say, take a walk, take a break from, your regular work and do some activities, right? So these notifications are basically very useful nowadays. If we talk about the AI and healthcare industry, these notifications again specifically becoming very important. For example, it can reduce no-show appointment bookings, where it keep reminding the patients, right, where you have the appointment at certain time, certain places, right? It might come before 1 hour or 2 hour before the appointments and all. It not only reminding the patient about their appointments, it's also basically bringing a trust to the doctors or the hospitals, because it's reminding the patient feel that basically hospitals or the doctors are caring about them and reminding them at a regular interval to do the regular checkups, or let's say come to the hospitals for the appointments. So yeah, this is one of the important use case of AI chatbots. Yeah, again, it comes to the insurance selling and self-claiming. So there are a lot of products in the industry for especially insurance, and we normally got a lot of calls, you can say, or basically it's a spam sometime, where a lot of calls you get, and then normally people are not very confident which insurance to take, what policy to take. And then also sometime when when the agent manually tells about certain policies and health policies, what happens is they miss few of the very important points. But once you automate these things through, let's say, the conversational AI thing, including, let's say, the chatbot and all, it becomes very streamlined and very error free, you can say, where all the required information is absolutely passed to the buyer. Also, based on different criterias, AI chatbots can suggest what insurance to take, what not to take. So these are the places where conversational AI are basically very helpful, where it can suggest certain insurance policies, and also helping in the claiming process. Let's say even if you bought the insurance, but when it comes to the claiming it, right, there is a very tedious process where you need to go through different documentations and all. And when it comes to collecting all those, chatbot can actually automate all these and make the overall process very streamlined. So yeah, we are a couple of our customers are actually started using it for automating certain things, and it's really beneficial for both the parties, buyer and sellers. Yeah, and finally it comes to the patient experience. If we talk about healthcare industry or the hospitals and all, right, the patients are basically their leads, one way, right? And this is very important that their patient engagement is very solid, and their experience are also solid. So right now, if you see many of the big organizations working in the healthcare have dedicated team for the patient satisfaction and engagement. The only way to improve the engagement, or let's say the existing service, is to get the positive feedback. Get the feedback positively from the customers, or let's say in healthcare case, it's patient. Now chatbots are really good at collecting feedback without affecting or let's say getting offended. So let's say someone is telling about your service is bad and all, right? If there is a human sitting around, they might get offended, right? I am working so hard, but still the feedback is not that great, right? But chatbots are not a chatbot can really handle it good, and then they can take those feedback and then analyze and feed it to your system. And obviously more engagement and satisfactions means more revenue to the hospitals or such health organizations. Yeah, so lastly, we'll talk about the impact of chatbot and healthcare professionals. So what I believe is, the chatbot and obviously the professionals, even in any industry, I believe they will coexist, because the certain things which the professionals are doing, which is not that critical, can be handed over to bots, these bots which are not critical, and then they can focus on certain critical things, right? Where whether it's a for example, let's say if it is a surgery, obviously any machines or bots cannot do that. But let's say when it comes to handling a simple guidance or suggesting few things, the chatbot can easily do that. So those things can be done by chatbots, and then which are very critical can be done by the professionals. Also, they can help suggesting them certain things which can remove those manual errors, right, which normally any human can do. The chatbot can act as the assistant for them, right? So when I say coexist, then what you need to do for this? So basically you need to uh, uh, aware about how the chatbots will help you doing certain things, what are the solutions available in the market, right? And then how to use them efficiently. So those are the few things we must be taking care about. If you talk about the developing nations like India, which is where the overall healthcare industry itself is understaffed. So their bot can play a very big role. For example, just if we just take a very simple example of appointment booking, right? If we go to any public healthcare hospital in India, you need to be in a queue for hours to just take an appointment, right? If we deploy a chatbot, the healthcare professional who is handling this thing can also do something else which is better than this, right? And then patient also have convenience to book it from let's say home itself. So that way the coexistence is very necessary, and then also we need to understand how efficiently we can use that. Yeah, so what next is, as we are feeding a lot of data in AI, especially healthcare is a little sensitive industry where the data belongs to the patients are very critical as well as very personal. So data security is one thing comes into the picture. Many countries already have certain compliances which you need to follow if you even starting a single thing in the healthcare industry. For example, for us it's you need to be HIPAA compliant to start something in the US, right? Same way, each country is coming with the different data security policies and all. uh, Again, adoption of chat gpt, I mean the generative AI, example chat gpt, right? So these are the stuff uh, where the industry will go. For example, document scan, what we talked about earlier, right? So for example, the application of chat gpt can be, it can scan the overall lab report and suggest whether the parameters are fine or not, or you need to talk with the doctors immediately, right? And there are a lot of wellness apps are also coming, whether it's a mental wellness or other health systems, right? Also, NLP, you need to enhance a little more in this, especially for the healthcare, because when we talk about AI, it's become quite horizontal, and then we need to be a little industry specific when it comes to artificial intelligence, especially the NLP part. For example, if someone is saying, writing M in healthcare, it means male. But someone is writing the same M in e-commerce, it means the medium sized t-shirt. Might be different, something different for the different industries. So NLP and other things need to be more powerful as well as specific to the certain industries. Yeah, so these are the things where the industry need to move, and the AI will come into the picture. Yeah, happy to take any questions if you have.
There is a question in chat window.
I'll read out the question for you. Juliana is asking, do you have any conversion rates from chatbot to sales? And does it vary from service cost?
Okay. Yeah. So, is it specific to the healthcare? Then we have one customer, MREF, which resolved over 63% of their incoming queries by using our platform. And there, this means like the more customer satisfactions, and obviously that will increase their conversion rate also. And the second part of it is service cost. Service cost depends on mostly the number of conversations coming into the picture. So yes, some way it's related. But yeah, I mean, more conversion rate means the more incoming queries means more service cost, and it leads to the more conversion rate as well. Yes, so on that part, we have our own NLP system. We have done some customizations on top of the certain models. We train our own model. Specific to the health industry also, we did some changes. For example, I can give you a specific example, like let's say we have the inbuilt entities of the body parts, or we have built one bot for the symptom checkers. For example, let's say if you give them 3 or 4 symptoms, it can tell you what will be the probability of certain the disease. Also, let's say if you write, I have broken arm, right? So it can extract exactly what is actually what body part is affected. For example, it will take take arm as a affected part, and then suggest you give you suggestions based on that. Yes. So right now, the pricing is based on the number of conversations coming into the system, and also what kind of features you are actually using. So we have two kind of pricings. One is obviously on the website with the basic feature listed, and let's say if you have certain needs, a specific need, you need to talk to the sales, and then they will propose you the proper plan. Yes, we provide certain APIs also. Also, the system is capable to integrate with the many systems. As I said, like
I was trying to contact with Laura. Okay, sorry for talking, but I hope you enjoy this lesson.
Okay.
Maybe you can have any time.
So the next question, yes. Yeah, so for API side, yes, we do have APIs. We also provide APIs, as well as we have certain integrations where you can call your own API also. Like we support webhooks, as well as we have something called inline code, where you can write custom codes to call your own APIs. Uh, yeah. Right. That's correct. So that's a very good question, I think. Right now, we have not something like this, but we'll really love to do uh, some some more stuff in that directions, especially building something for the uh, blind people, or let's say the yeah. So we have, by the way, speech to text. So that can be helpful here, where you can enable the speech to text, and whenever the message comes, it will speak out. As well as you can record a message and send it back. So it's a both ways. So yeah, I can think of right now one feature, and then but that's again the good idea, to build something exclusive for these people.
Another question that I have is, while you were talking about pricing, you explained us how you price it. But how did you come to this pricing? Was it a bottom-up approach that you used? Because you're basically selling software as a service, and all of the costs that you incur are R&D costs. So how do you spread it across to different projects, or how do you price your product? How do you know that's the correct pricing?
Right. So as I said, we started long back. We started selling in 2019, and we evolved a lot from that time. So we revised the pricing as well, quite a few times. So it's totally based on the market research, as well as the usage patterns, which will benefit both the parties. For example, let's say if the pricing should not be like where you are overloading the system, and then it is not justifying the cost on our side. As well as in the reverse way, it should be cost effective for the customers also. For example, if you're creating less conversation using certain feature at if you're not using certain features, right, you should not be charged for that, right? So it is well researched, based on market competitors, you can say. And then obviously one part of it is talking to our customers, how much value we are generating for our customers, right? And then we are deciding on the pricing. Yeah.
Does anyone else have more questions? Oh, we have another one.
Yeah, so to answer to Vineet, so normally we did not get into such situation yet, but obviously if we talk about the bot, right, it has also accuracy, and then based on how much data it got for training, right? So that's a very important thing. So initially what happens is, once bot is starting learning phase, it do a lot of mistakes, right? So even if you set accuracy high, it can either do not reply, or sometimes reply with the vague answers and all. But as the time passes, and it has the data which you can, or they can learn from, or you can train them based on that, the accuracy improves, and then obviously they are able to answer well. So that's why we have the feature of suggesting customers what kind of training they can do. We call it self learning. So where based on your past conversations, it will suggest what kind of questions you need to feed and what kind of answers you need to suggest or correct them. So yes. Yeah. Any other questions from anyone?
I think that is that. So I would thank you so much for helping us with this session and giving us all the knowledge. And I would also like to thank the rest of the participants who joined us for this session. And if you want to communicate with the team of Kommunicate, you can contact them via LinkedIn. They can just drop their LinkedIn and we'll share it with you guys. Thank you so much.
Thank you for having me, and special thanks to Vineet for inviting me. And also the questions were really great. Definitely, it will help us to improve as we got one question. How we can build a bot for special people. So yeah, thanks a lot.